Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
So hi, good evening everyone. I am Dr. Srichna from Drools and we are delighted to have you all join us for today's webinar. Organized by Drools in collaboration with the Association for Veterinary Dermatology India, AVD. Thank you all for taking the time to attend this session. To begin, we have Dr. Ramani Jairam, Secretary IAVD, to deliver the welcome address and set the stage for today's session. Over to Dr. Jairam.
Good evening, everybody. Request participants to mute their speakers, please. Yeah. So we are.
Dr. Jairam, your speaker is muted. Please unmute yourself.
Hi.
Yes.
Good evening, everybody. And thank you, Drools, for organizing this series of webinars which are benefiting all our veterinarians, and all the veterinarians are also getting benefited by all the products that Drools make. So AVD, as everybody knows, has been organizing these series of webinars, and today my very good friend Dr. Sumathi, Professor of Clinical Medicine in Tanuvas, is going to be delivering a lecture on otitis. As everybody knows, otitis is a big problem for all veterinarians, and the differential diagnosis and the treatment is very challenging. And Dr. Sumathi will be giving practical tips which will help all of you in your daily practice. An important note from AVD, we are 100 days away from the ICVD at Bengal. The venue is the Royal Bengal ITC, and it is from the 4th of June. Please mark your dates, book your tickets. The best speakers are going to be coming over. Right now, one of the best Indian speakers is going to be delivering today's webinar on otitis. Over to you, Dr. Sumathi.
Yes. So before we start, I would like to request everyone to please fill out the registration form shared in the comments box to receive your certificates. And now it's time to introduce our esteemed speaker, Dr. Sumathi Devaraju. Dr. Sumathi Devaraju holds a PhD in veterinary clinical medicine and is presently working as professor in the Department of Veterinary Clinical Medicine at the Veterinary College and Research Institute, Namakkal, Tamil Nadu Veterinary and Animal Sciences University. She has put in over 20 years of dedicated service in academics, research, clinical practice, and extension. She specializes in small animal internal medicine, gastroenterology and hepatology, small animal ultrasonography, small animal critical care, and small animal dermatology. She also holds a postgraduate diploma in regenerative medicine. Dr. Sumathi has served as co-coordinator for postgraduate diploma programs in 2 subjects for 4 years. During her tenure, she has spent 15 years in research, 13 years in extension-related clinical work, 17 years in undergraduate teaching, and 12 years guiding postgraduate and PhD scholars. She has been the co-organizing secretary for the International Workshop in Working Dogs in 2014 and the first ICVD in 2022, and served as course director for ICAR CAFT in 2014. She has also assisted in organizing numerous national and international conferences and webinars. We are truly honored to have her with us today for this important session on otitis in small animals. Diagnose, treat, prevent, a practical approach to identifying causes, interpreting ear cytology, managing acute and chronic otitis. We now hand it over to Dr. Sumathi Devaraju for her expert session. Over to Dr. Sumathi.
Good evening, one and all. Thank you, Dr. Jairam, for your kind words, and thank you, the Drools team, for your introduction. A small correction, now I am being placed as professor at Madras Veterinary College. So
Yes.
I'm now serving in Madras Veterinary College. So it's already we are running late, so we'll directly get into the session. So are you able to see my screen?
Yes, doctor, visible.
Oh, yeah, okay. So today's topic is otitis in small animal, how to diagnose, treat, and prevent. So coming to the introduction, ear disease is a common problem in dogs and cats. And there are a lot of papers around the globe telling you about how frustrating it is for both the veterinarian, the dog, as well as the dog or the cat, and as well as the client, because it has lot of issues because it's recurring. Second thing is it's difficult to manage by the clients because difficulty in applying the medication. Second thing is the stress which they undergo because the dog keeps scratching or shaking the head. That adds on stress to the clients. And another important thing is most of us, we have the pet, we share the bed with them, they sleep with us most of the time, and that smell that arises from the ear disease is often very difficult for the clients to adapt. Okay, so being a very big problem, there are a lot of papers that are out, like how it causes an issue. And 15 to 20% of the dogs are having ear diseases and 4 to 7% in cats. There are many clinical entities that can affect the ear. A wide spectrum is seen, and individual cases may vary in severity from trivial to chronic and sometimes even life-threatening. Just to go on a basics like anatomy part of it, I'm not going to deal much about it. I saw a lot of youngsters into this group, so I thought like I'll just put it into the anatomy part of it. So the anatomy of the ear goes like external ear, pinna and external ear canal, middle ear and inner ear. External ear, which plays a very vital role in all these problems, has a vertical ear canal and a horizontal ear canal. The main problem is because they have a L-shaped ear canal. You can see the anatomy, that is the skull part, and you can see the otoscopic view. Here, you can see the malleus, which is seen on the otoscopy as a bright white structure. And this is the pars flaccida, and this is pars tensa. And pars tensa plays a very important role when we do otoscopic examination in diagnosing various conditions. Coming to the anatomy of the ear, pinnae of the ear is very important because they play a crucial role in predisposing an animal for otitis. The pinnae may be erect or it might be pendulous, depending upon the breed. Ear canal is variable in length. The cartilage structure and the bony external acoustic process are lined by the skin. That's why ear is a part of the dermatology. Association between apocrine gland density and otitis externa has been shown. So if there is a apocrine gland more, then there is chances that there is a otitis externa. And we know that tympanic membrane is the check post, so it keeps everything in check and doesn't allow things to get an entry. So it acts as a check post over there. Inner ear is connected with the central nervous system, so it is important for hearing, as you know. The tympanic cavity is below the tympanic membrane, and this is very important because it has innervations like facial nerve, vagal nerve, carotid, and lingual arteries, which are very proximal to it. So if you meddle with the middle ear, you are going to cause a lot of problems. Damage to the facial nerve. So what are all the issues you will end up, because there are a lot of clients, they try to do their own way of cleaning the ear before they could come to us. So they, most of them, they do it with the what do you call, some handlers or in the grooming parlors, they get their ears, dogs' ears cleaned over there. Sometimes they end up in a very big problem. So they have a facial nerve damaged, which is being exhibited at dropped ear or lip drooling, absence of palpebral or corneal reflexes. So it's always very important that you advise the client not to get a cleaning of the ear done by um, people who are not authorized to do it. So we also have this tympanic plexus and tympanic bullae. Tympanic plexus, it's very important because when you happen to handle a case and you want to go for a meningotomy to clean the tympanic bullae, if you are not getting into the proper channel, and if you hit at the pars flaccida instead of pars tensa, you are going to injure the plexus and you are going to cause bleeding in the ears. Today I had one such situation scenario where the animal started having bleeding from the ears and there was a head tilt, and I had to rush the case to the surgeon. So don't try to do something which injures the pars flaccida. Tympanic bullae is a egg-shaped area that acts as a reservoir to trap debris and the toxins in the ear. So physiology, you know that the sound waves are collected by the external ears, tympanic membrane vibrates it, middle ear transmits, and vibrations are received by the inner ear. The hair cells of cochlea transmit the nerve impulses to the brain, and the pressure is released, the animal is able to hear the sound. So if you are going to damage the ears, then the hearing is impaired. So coming to the microscopic structure of the internal ear, you have the normal ear canal contains a stratified squamous epidermis, hair follicles, and associated sebaceous and ceruminous, which is nothing but apocrine glands. Why is it important? Why am I bringing it here? Is breeds are predisposed to otitis externa, such as cocker spaniels. So they are one of the breeds that are very prone for your otitis externa, because they have increased amount of glandular tissue compared to the other dogs. So whenever a client has a cocker spaniel pet which is being purchased as a puppy, you can slightly inform them about the possibilities of their dog, which is going to be predisposed to otitis externa, not as a threatening point so that they get the fear, but to tell them or to educate them that these dogs are prone for ear diseases, so they can have a check whenever they are having a visit, or once in a while they can come and have a check with us. Otitis externa results in increased production of cerumen with a low lipid content. Okay, so not with increased production of cerumen, but with lower lipid content and increased ceruminous gland activity. So chronic otitis externa results in permanent changes. So why do we need to have a thermometer for the ears? It's definitely important because when we are having a ear examination, it's better we do a ear temperature check, which is going to be slightly lower than the rectal temperature. So because we need to know if the microflora of the external ear and the microenvironment is proper. So we need to look for the pH, temperature, and relative humidity within the external ear canal. So if this is altered, these animals are more prone for otitis externa. So if there is any raise in the relative humidity, or if there is rise in the pH, they are going to have the issues. So cerumen is principally contained of lipid and sloughed epithelial cells. If the lipid content is more, as I told before, it is going to have a otitis externa. So what are all the clinical signs? As we were discussing in the start, the animal is going to have a pain, so it will not allow you to touch or handle the ear. Frequent scratching of the ears, shaking of the head. The shaking of the head is very vigorous, that it shakes until it cries in pain. There is a head tilt, lesion in the skin of ears, swelling in certain conditions. Nature of the cerumen, like either it is going to be black, crumbled, or it is going to be white, or it can be waxy, purulent, blood tinged. So it's going to be changing. Less commonly hearing loss, foul smell, which is a very big issue when we deal with such cases, and as I discussed, discharges. So it's for example, if somebody asks, doesn't the ear have normal micro environment and normal microorganisms? Yes, exactly. There are normal microorganisms that are present in the ears, but when they are in excess, they tend to have otitis externa, and that which are not normally present are added on when they are having a otitis externa. For example, you check in this slide, malassezia is there. You have Staphylococcus pseudointermedius, you have Bacillus species in the normal microflora. But when you come to the other side with otitis externa, you have Staphylococcus pseudointermedius, you have Pseudomonas aeruginosa, you have Enterococcus species, you have E. coli species. So there is a wide range which are present in the otitis externa. So how do we proceed when we have such cases? So basically, we need to go with a visual examination. If you have a handheld otoscope, it's fine. First, see it with your naked eyes, how it looks, whether there is any swelling, whether there is any pain, whether there is any what do you call as increase in temperature. So just look, touch, and check for the auricular cartilages. Then go for a handheld otoscope. If you have a video otoscope, you can go with a video otoscopic examination. Before you proceed with video otoscopic examination, you can also go with cytological examination of cerumen and exudate. Sometimes you can use it with the help of your otoscopic examination also. You can take the material for cytology. You can also collect samples for culture and sensitivity. You have to clean the ear canal. So first when you are visually seeing, you don't do any cleaning or any procedures. First see how it is looking with a handheld otoscope as well as with your naked eye. First see it, how it is looking. Then you can go with cleaning, and then you can use your video otoscope, because when you are going to use a video otoscope, if the ear canal is not clean, the visualization is obstructed. So in such situations, you have to go for cleaning the ear canal and then facilitating the examination of the deeper canals. You can also go with radiography. Now we have advanced diagnostic CT. CT also has a very good advantage of examining the ear for space occupying lesions, or when there is going to be any accumulation of content in the ear canal. You can also go for biopsy for the histopathology if there is going to be any growth. So breeds that are prone, we should know, right? Which are the breeds which are more prone for such conditions. Cocker spaniels and Persian cats are predisposed due to defects in keratinization, which may be associated with ceruminous otitis externa. Springer spaniels, miniature poodle, Sharpie, German shepherds are prone to otitis. Any breed which is predisposed to atopy, they also have otitis. So usually bilateral. Dogs with pendulous ear pinning, they are more susceptible for otitis externa. Hair within the external ears, such as poodles, they are predisposed for otitis. Yorkshire Terriers are predisposed to bilateral pinnal alopecia and hyperpigmentations. Even Dachshunds, they are more prone for pinnal alopecias. And young dogs are more prone for foreign bodies. Signalment, as I told, young dogs are more prone for foreign body related issues. Older cats are also associated with otitis cyanosis infection. And between 3 to 6 years of age in dogs, otitis is very common occurrence. Coming to the management and lifestyle, we need to check for the diet, look for the deficiency of zinc and essential fatty acids. Also check for any polyuria or polydipsia to know whether it has got any hormonal issues, because they play a role in otitis externa. Whether it is a kennelled or it is in indoors, or whether it is being exposed to outdoor environment. Exposure to sunlight should also be taken into consideration, because exposure to sunlight will have a kind of pinnal affections because of actinic radiation, which in turn will predispose to otitis. Like presence of other animals with any particular conditions like mange or dermatophytosis or otodictis has to be ruled out. Nowadays, no people I think like of late, most of the places are being set up with swimming pools in a bigger kind of a setup. People bring the dog on for holidays for a swimming activity. So these dogs that are having more exposure to swimming activities are tend to have ear diseases. Working dogs, as I told, working dogs and young dogs, dogs that frequently go for any picnic around in the areas where there is grass on, they are also having this foreign body affections, because of which it also leads to otitis. Grooming, for example, people who take it for spa, grooming, all those things, they tend to end up with clipper burns. And this clipper burns is again a long kind of procedure to treat such conditions. Evidence of underlying disease, we need to know about whether it is a recurrent episode, whether this ear disease is having repeated occurrence, whether it is bilateral or unilateral, if there is going to be any facial ear or pedal pruritus, or whether it is seasonal, it can be because of atopy. Dietary intolerances, like food allergies, can also cause otitis externa. Allergic contact dermatitis, which may affect the concave part of the ear, ventral aspect of the pinna, they also cause otitis. For example, when we try to use certain even ear cleaning agents. So these ear cleaning agents will also predispose for allergic contact dermatitis. There are certain vehicles which are not suitable for constant cleaning of the ears. For example, everyday cleaning of the ears, you cannot use such solutions. So they might cause allergic contact dermatitis. Endocrinopathies, particularly hypothyroidism and hypoadrenocorticism, can also cause ceruminous otitis externa. So, as I told, sun exposure can also cause to kind of actinic radiations. So when we are talking about otitis, I also thought it will be important to know about examination of the pinnae for various conditions. Like you have conditions which causes head shaking and issues to treat, like your ear tip vasculitis, ceruminous adenomatosis, scabies, ear margin seborrhea, and sebaceous adenitis. I just wanted to talk about it for few seconds. Vasculitis, already there will be the tip of the ear which is discolored and bleeding, which will not respond to any kind of your antibiotics, and basically it might be because of type 3 hypersensitivity disorders, and there is damages in the blood vessels, and most often it is due to some drugs or post-vaccinal like rabies vaccine, food hypersensitivity, sometimes insect bites, and even other malignancies and infectious diseases. So this respond well for pentoxifylline. I'm not getting into the details of it. Pentoxifylline is used. If pentoxifylline doesn't respond, then you can go for alternates like your cyclosporin or azathioprine. Glucocorticoids is a very good alternative. You can also go for carbon dioxide laser ablation in such situations. Ceruminous adenomatosis, here again, these are also included under the otitis certain factors, which I will explain you in the coming slides. So this can also be removed using your carbon dioxide laser ablation. I think most of the practitioners are started to use this carbon dioxide laser ablation procedures. So it can be removed using laser ablation. Scabies, we know like there is a ear margin pruritus. Take a scrape, check for it, and then go for acaricidals. Ear margin seborrhea, here it affects the pinnal margins. It might be the entire body will be all fine, only the ears will be having crusting or scaling, and because of it, the animal will find uneasy. So this most often happens with the dogs with pendulous ears, like your Dachshunds. So ear margin seborrhea, you cannot cure it because it's a kind of manageable only. So you can go for shampoos like benzyl peroxide, salicylic acid, and phytosphingosine. Topical blend of fatty acids you can apply. Sometimes when it is very severe, you can go for a short course of glucocorticoids. Sebaceous adenitis, again, like it needs only a management. So here the breeds that are affected are poodles, Akitas, Samoyeds, or poodle crossbreds are affected. Here we need to have a certain moisturizing agent. There are a lot of products now into the market with jojoba oil. You have aloe vera. A lot are available in the market. You can also go with cyclosporin as a systemic treatment. You can also include vitamin A, or you can use a combination of doxycycline and niacinamide along with supplementation of omega-3 and omega-6 in such situations. So coming to otoscopic appearance of the ear canal and tympanum. So ear should be combined along with the body in case of examination. So you have to check the entire body of the animal, then go for ear examination, obtain a beautiful history, examine the animal. As I said, like go for the complete collection of history, complete collection of the data of the ventral presentation of the lesion and dorsal presentation of the lesion. Ear canals, you just first visually see, then use the otoscope, and then clean them properly, and then examine. Whenever there is a problem in one ear, don't examine only what that particular ear. You do the examination of both the ears. Whenever we are going to handle a case with otitis, the animal is not going to stay quiet unless it is really a trained dog. Even a trained dog will have a resistance. So it is better you go for a smaller period of sedation, like a 20-minute sedation. You can use it and then go for a gentle examination so that you will have more access in examining, as well as in case if you need to do some procedure within the 20 minutes, you can do it. And certain breeds like poodles, they will have a lot of hair in the external ear canal. So it will affect the visualization. So you can go with a regular trimming, or if you can't trim it, you can also go with hair removers to remove the hairs and then examine the ears. So you have to look for the like secretion of the ears and then collect them. You can also go for cytology. Cytology is really important when you are going for examination of the ear to know about the type of material in it. So sedation, it is completely your choice. And just to put it on the slide, I'm giving it. So 20 minutes sedation is enough for the ear examination. Even for ear cleaning, 20 minutes is more than enough, unless you are going to go for any procedures to remove mass or something, then you can go for a general anesthesia. Otherwise, you can just go for a 20-minute sedation. You can go for a cocktail with ketamine, midazolam, and azithromycin, or you can go with xylazine. That's what I said. It is up to your choice. Just the timing is 20 minutes. There are also many newer drugs that are available for the recent sedation, depending upon the age of the animal, the condition of the other like cardiac status. You can just go for a choice of anesthesia. So when we are going for a video otoscopic examination, this is going to be the normal appearance, which 2-3 slides I'm going to show you. This is going to be the normal appearance of the ear canal. You can see they are very pale. They are not varicose. So the blood vessels are all looking normal, like pale. You cannot call completely pale pink, but it is pale, slightly creamy in appearance. The blood vessels are not too prominent to see. So you can, the normal appearance looks like this. This is also the what you are seeing on the three things on the slide is also normal appearance. One is having a little bit of excess cerumen, but that's not a problem. The second one is also having some kind of ear wax, you can see. So that is also normal because the ear canal is going to be normal in appearance. It's wide and there is no big occlusion here. Third one, like appearance of hair in the external ear canal. This is also normal. So this looks normal on the otoscopy. So coming to the abnormal appearances, see for the first one, you can see the very prominent blood vessels. So you can see the varicosity here. You can see there is oozing lesions, kind of oily kind of lesion here. The second one is there is a lot of bumps on the ear canal. So you can see a lot of bump structures, which is looking like more like a cystic and narrowing of the ear canal. So ear canal is narrowed. The third one is more pinkish. So it is almost kind of inflamed structure. You can also see a tick present there. So this is again abnormal appearance of the external ear canal. You can see highly narrowed ear canal. You can't even go beyond this one. So there is very narrow kind of a structure. Here you can see ceruminous cyst adenoma in the second picture. Third one is a ear tumor. So you can see there is a tumorous structure that is protruding out of the ear canal. So these are abnormal appearances. This you will not be able to pick it with your naked eye. Definitely you need a otoscope, and your handheld otoscope will help you to visualize only up to certain distance. Okay. So if you want to see it in very much in detail, you have to go for a video otoscopes. There are 2 video otoscopes. Just to visualize alone, you can use one. The other one is for intervention also. So there will be an interventional port wherein which you can send the for interventional procedures. You can use the interventional part of it and then go for removal of this mass using a otoscopy itself. So here you can see abnormal appearance of the ear canal. First one is the image, whereas there is a rupture of the tympanic membrane. You can see highly inflamed erythematous blood vessels. Second one is the swelling of the tympanic membrane, because the bullae is filled with infection and it pushes the tympanic membrane outside. So it looks more, instead of flat, it looks more concave because there is lot of inflamed material which is caught in the tympanic bullae. The third one is again a mass in the ear canal. See, why is it important is it is good enough that when you examine, you will be able to tell the prognosis to the client, whether it is going to get all right or its dog is going to have the issues unless the um, masses are removed, or whether the inflammation has to be subsided and how long it takes. This can be explained to the owner because you are going to see all these lesions. So here you can see the first one. There is a rupture tympanic bullae. It was a video. Video is not playing. Here what happens is if there is a rupture, a mild rupture in a tympanic bullae, what will happen is when you flush saline, there will be a bubble which comes out of that ruptured area. So whenever you are going to clean a ruptured tympanic membrane, you should be very cautious because you are going to intervene into the middle ear. So here you can see again there is a rupture tympanic bullae in the second one. Third one is also there is inflammatory changes along with rupture tympanic bullae. I think I had a video of grass on. It's not here. Maybe in the subsequent slides I might have it. So coming to classification of otitis, whatever it is, only when you examine it completely, you will be able to say whether it is otitis of what origin or what type. By the level of involvement, it has been classified as otitis externa, otitis media, and otitis interna. By broad category of reactivity, it is a little bit of confusing, so we will not deal in the second category. Third one is based on etiology. Etiology is again allergic and parasitic are the two different way of classifying it. Fourth, by appearance. This plays an important role by treating based on the appearance, that is purulent, ceruminous, erythematoceruminous, proliferative, ulcerative, and varicose. So based on this, you will be able to tell purulent, definitely it's going to be a bacterial infection. Ceruminous may be endocrinopathies. Erythematoceruminous, you have to know whether there is any kind of increase in the ceruminous gland. Proliferative, whether it is nodular or whether it is tumorous. Ulcerative, may be allergic disease. Varicose again, and inflammatory. So coming to pathogenesis, this is a very important part of the classification for otitis. So based on PSPP, which is a short form you to remember, primary, S is secondary, P, next P is perpetuating, another P is predisposing. We need to know all these four. Unless you know all these four, you will not be able to approach a case to either prevent or to treat. So coming to the primary factors. Primary factor for a otitis externa is going to be allergy. Allergies can be because of atopy, food or contact. Contact in this case, not because of the chemicals which they are using on the floor, it is because of the chemicals that are used for the ear cleaning purposes. Endocrine, important one is hypothyroidism and hyperadrenocorticism. Autoimmune or immune mediated, the most common one is the pemphigus. Just leave the rest of the things. You have vasculitis and drug eruptions. Keratinization disorders, I discussed with you the Pinnal diseases, sebaceous adenitis, and primary idiopathic seborrhea. Ectoparasites, we also know it is mostly the ear mites and demodex. Foreign bodies, grass on and sand that which enters the beach for swimming, and ear canker. Most of the people, when they see the tick in the ears, they go for dusting the ears with tick powders. So that also has to be advised when we are going in with giving a product of tick powders to the client, not to dust in the ears. Idiopathic, that is juvenile cellulitis, is also again one of the condition which is being included under the primary causes. Secondary causes, nothing but two things, bacteria and the yeast. Bacteria, again, acute disease and chronic disease. Acute disease, mostly you have the gram positive Staphylococcus, streptococcal, and corynebacterium species. In case of chronic, it is going to be both gram-positive and gram-negative bacteria, Enterococcus, Pseudomonas, and E. coli in the chronic conditions. Yeast, again, Candida is uncommon, yeast mostly Malassezia. So perpetuating factors, that is pathological changes in the external ear canal, the changes in the canal wall due to inflammation causing failure in epithelial migration. It can be acute change like edema, hyperplasia, and in case of chronic changes, it is going to be a proliferative changes like ear canal stenosis, which we saw in the picture which I had shown in one of the slides. Calcification and like coming to the glandular tissue, you have a hyperplasia of the ceruminous and sebaceous glands. It is also more related to the breed, and changes in the tympanum. One is dilatation, rupture, and sometimes diverticulum can happen. In case of otitis media, as we told, acute and chronic. Acute mostly happens because of foreign material and mucopurulent exudate. Chronic, there is a biofilm formation, which is going to be a very tough thing for us to deal in chronic otitis media. So there might be bony changes in the bullae, which can be diagnosed by us based on the X-rays. And also nowadays we also use CT. Predisposing factors. I spoke to you about the slides. You might have thought what this lady is speaking about breeds, all these things. I know why. But predisposing factor is very, very important because you are going to educate the client initially, even before things are going to become worse. Like confirmation. So hairy ear canals for poodles. Tell them to clean the ears as and when possible. And in fact, you can also go with cleaning of the hairs in the ears using the chemical method of removing hair removers can be used. Pendulous thinner, basset hound, or any pendulous ears, you tell the client to have the ears ventilated a few time in a day. So that has to be told. And when there is a breed, I don't think we have a lot of Sharpei in this in our country. So stenotic ear canals are naturally present in Sharpei. So in case of Sharpei dogs, it's always better to examine them periodically. Like once in 3 months, you can ask the client to bring the dog and examine because they have naturally a stenotic ear canal. Increased glandular tissues, as I told, Cocker Spaniels. So tell the clients to come and evaluate the dog periodically when they are going to bring them as a puppy. So this is what I was trying to tell you about the breed. Excessive moisture, like environmental factors like heat and humidity. When I talk about heat and humidity, there are certain places where in which the dog finds a place in the winter where there is heat. So in the vents, AC vent outside, like where there is a heat exposure, they tend to go and occupy that place for seeking heat. When they are constantly exposed to such type of heat, they are likely to have this issues. And again, water, swimmers here, which we spoke about it, and water-based cleanser. When they are continuously using a water-based cleanser, they are more prone. And extra label use of antibiotics mixed with certain aqueous solution also causes issues. Obstructive ear disease like neoplasia, polyps, and cyst are also an issue. Systemic disease. In general, any systemic disease can lead to skin issues, and which also has an effect on the ear. Treatment effects, inappropriate ear cleaning solutions like acid, astringents, alcohol-based, sometimes using earbuds, overuse of earbuds, traumatic cleaning, and overuse of topical antimicrobials. These are a kind of predisposing factors. So primary causes hypersensitivity, atopy, and dietary intolerance. You can see in the images how badly the ear gets affected because of atopy. So this is the first picture is a dog for Rajapalem which has pinnal lesions. Here the second one is inner part of the pinnal area where you can see a kind of thickening. The third one is otoscopic examination, wherein which the severe inflammatory changes can be noted. So the contact dermatitis, when you use improper cleaning solutions, the vehicle itself will cause injury. You can see there is inflammatory changes and erythematous inner ear. Coming to autoimmune or immune-mediated diseases, you can see a crusty oozing lesions from the ears. So you can also go for a cytology which will reveal the acantholytic cells. Next one is the otodector cyanotus. Most often, all the practitioners might have been doing this in a routine basis for any cat cases that comes. Looking upon the secretions itself, we'll be able to tell that this cat might be having a ear mite. So coming to demodex, see, you cannot overlook demodex thinking it might be only seen on the skin scraping or in the parts other than ear. It can also occupy the ear canal. We have seen lot of cases with severe itching when the ear material has been collected and subjected for cytology. We could be able to see demodex mites. So other ticks and mites can also occupy the ear. Endocrinopathies, you can see the slide, see how whitish, waxy the secretion is. This kind of secretion is more common in endocrinopathies like your hypothyroidism, hyperadrenocorticism, or cases with Sertoli cell tumors. You can see such kind of a sticky, waxy secretions. Coming to other primary causes, I was telling you, right, grass on. So younger dogs or hunting dogs or police dogs or military dogs that are exposed to run in the areas where there are a lot of grasses, this has a problem. This grass on is very sharp and it will damage the tympanic membrane. This grass on, until it is being removed, it will be causing changes, and there is secretions and rupture of the tympanic membrane happens. An animal will be having all the signs of otitis externa. So not only this hunting dogs, no, our Mudol hound, Rampur hounds, here we have Chippipari, Rajapalim, which are being used for hunting. They are more predisposed for this grass on. Other causes, juvenile cellulitis, you would have seen in most of the young puppies, which have lymphadenopathies and as well as secretion from the ears. So secondary causes we already spoke. It is bacterial flora and yeast infestations. So cytology is very important whenever you are seeing a case of otitis. So whenever you see a case, do a cytology, check it immediately, do it in your practice. So in the lab, in-house, you can use either diptic stain or you can use a field stain. So you can look for presence of cocci, rods and yeast. So this will give you an idea that the animal is having a secondary causes of otitis externa. So you need to treat with specific agents like antibacterial agents or a agent that contains your antifungals. So you have to choose a ear medications or ear drops which has all these preparations. So this will help you. Unless you do this, it is very difficult to treat your cases. Coming to perpetuating factor, I already told there is a problem in the confrontations. Like there is also occupying by the masses like cystadenomatosis and squamous cell carcinoma, melanomas. They occupy the ear canal and they cause yeah, occlusion of the ear canal, which also causes otitis. So this has to be removed. Unless they are removed, you will not be able to handle the case. Here, coming to the some progression of the otitis, we have either hyperkeratosis or fibroplasia or apocrine gland hyperplasia. All these three will cause increase in the soft tissue volume. So once the soft tissue volume is increased, there is narrowing of the lumen. When there is a narrowing of the lumen, the microenvironment changes. Microenvironment, not only humidity, the temperature, humidity, and pH gets changed, and this will either lead to microbial proliferation, that is increase the bacterial load or the yeast load, or it might cause an inflammation which will be visible on the cytology as degenerating neutrophils, and which all will lead to the otitis. Before you proceed for cleaning, you have to check the color of the wax, or the discharge. So type of discharges and the typical findings is dark brown, thick and waxy. It must be ceruminous otitis. Pale brown, moderate waxy and purulent. It can be a malassetial otitis. Yellow, it is mild waxy and purulent. It is staphylococcal otitis. Excuse me. If it is green, it is purulent and hemorrhagic. And also the consistency is little mucoid. It can be a pseudomonal otitis. So just check using a ear swab. If you check, you will be able to tell, oh, this is this kind of secretion. So it can be this one. Just put it on a smear, stain it, look it under the microscope, you will be getting clues. Just by looking at the secretion itself, you will make a diagnosis, and added to it, your cytology will give a clue. And this will help you in using the appropriate agent to clean the ear. So coming to the cleaning materials, what is required for a person to have their animal with otitis to be approached for cleaning is you should have a alligator forceps, cotton tipped swabs for routine cytology. You should have ear curates. You have to have material to collect the culture. So you have to have a ABST swabs. You should have a microscope slide. You should have flushing solutions like your ceriminolytics and aqueous flushing solution depending upon the examination. So you have examined, and now you will decide like which kind of agent I should use. Then you should have sterile otoscope cones when you are going to examine disposable cones, and 5 to 10 ml syringes can be used, and 6 to 8 inch 6 to 8 French urinary catheters. So you can go with the polypropylene or a rubber tubes can be used. So this is called as bulb flushing. So it can be done. So flush the ear, then again suck it out using the bulb, and then you can clean the ears using bulb flushing. Second, ear loop. Ear loop is used to collect the materials for your cytology or for your ABST. Tube flushing. You can go for red rubber tubing for tube flushing so that you don't damage the ear canal. It is a soft tubing. It can be inserted into the ear canal. You can use any material to flush the ear. So this is tube flushing. Cytology, I told, when you're doing a cytology, you will be able to pick either there is a melanin granules. You can also pick keratinocytes and corneocytes when you do it cytology, which will tell you whether it is a keratinization disorders. So you can also look for any cocci, or you can look if there is anything else like degenerated neutrophils are there, you can look for it. So here you can see a lot of cocci, red arrows, and here you can see the yeast, non-budding yeast and budding yeast. You can see there is an arrow mark which is indicating the white arrows are the white arrows are non-budding yeast, and the red arrows are budding yeast. So this is also again a picture of yeast with few melanin granules. Here you can see a lot of cocci and rods lying side by side. Huge keratinocyte is also seen. You can see the rods with red arrows and gray arrows indicates cocktail. This indicates non-pseudomonas infection. Here you can see a lot of neutrophils with bar bodies and dole bodies. These are not bacteria. These are not cocci, so don't misinterpret them with the cocci. So you have to look and pick the cocci rightly. Okay. So these are not cocci, so you just check them before you can interpret the cytology. So do the cytology meticulously, patiently, spend some time in looking at the cytological slides. So here you see a lot of abundant degenerated neutrophils as well as cocci and rods. This indicates there is a pseudomonas infection. Then coming to the agents that are used for ear cleaning. So first we have the cleansers and rinsers, then maintenance products. So you are cleaning them, then you can go for a maintenance product. So cereminolitics, you have phytosphingosine. I think there are during 90s and 20s we were unable to get this phytosphingosine containing products, but now there are few products that are available in the market. Phytosphingosine can be used and squalene. This can be used. This will be applied to the cerumen. It softens the cerumen and then it is slightly melts, and so that you can clean it and you can go for visualizing the ear canal. So cereminolitic agents are available. Coming to the next one is a maintenance product. I need, for example, some dogs are more prone for cerumen secretions. As we discussed, there are certain breeds. We need to go for maintenance products. For maintenance, again, you can use phytosphingosine, and that is very much available with us is the Epiotic Advanced, which is in the market, which can be used. So this is one of the products which are very much available for us as a maintenance products. So these are based on the pH, based on the acidic or alkaline nature. They can be used, and they maintain the pH, they prevent the bacterial growth, they deodorizes the ear. So this acts as a disinfectant. As I told, this acts as a disinfectant. So they can be used as a maintenance product because they don't allow further infection to happen. There are certain enzymes that are also available. I don't know if we really have it in our country, enzyme solutions that are used for cleaning. But these are present, the products that are present in US, most of them are not available in Europe, and the products which are in Europe are not available in America. So those products which are available in those two areas that are not available with us in some conditions. So to pick for the better product that are available. So here we have Epiotic, so that can be used as maintenance products, as well as you can use it for a cleaning products. So you can use, there are a lot of products. If you have some contacts abroad, you can buy certain products which has an enzyme which clears the cerumen. Coming to antibacterial products, we have enrofloxacin that is available here with us in the name of Aurico. Orbifloxacin, gentamicin, neomycin is available. I'm not very sure whether we have polymyxin, but in human preparations we have polymyxin. Silver sulfadizine, again, this silver sulfadizine is used in case of cases with clipper burns. So in such situation, the silver sulfadizine can be used. So use according to the etiological agents. TricidTA is one of the best one that are available for Pseudomonas infection and giving way for the biofilm. So TricidTA can be used when you suspect for chronic ear diseases. So this will break the biofilm and allow your antibiotic or antifungal to act. So you need the TricidTA as a agent to break the biofilm. So TRICDTA is now available with many of the companies that has come to us. Many companies are marketing with TRICDTA. So coming to antifungals, we have ketoconazole, we have miconazole. Uh, Posaconazole is available in Europe. I think it's not available in US. I'm not very sure if somebody from there, they can give an input. But you can use, because ketoconazole, miconazole is available with us here in India. Coming to anti-inflammatory products, there are papers which tells us use of dexamethasone is one of the best gift in ear cleaning, though there is a bacterial infection or a yeast infection or there is a chronicity or there is acute. This use of this dexamethasone as a steroid will help to keep the stability of the products and reduce the inflammation. And to maintain the stability, in most of the products, they use the dexamethasone as a component. So even if dexamethasone is not available in a product, for example, in case of epiotic, if dexamethasone is not there, they tell us like you can use 4 ml of dexamethasone mixed in 100 ml of epiotic, and it can be used in ear affections so that it maintains the stability of the product and reduces the inflammation. So the best available one is the dexamethasone for us. And dimethyl sulfoxide can be used. The other best one is mometazole. Mometazole again, so mometazole is again, I think we don't have that product, but it is also again a very good product which can be used, and it is a potent steroid that can be used. So coming to earwigs, I think I have not used it, so particularly I don't have any much of idea about using an earwigs, but in clients who cannot use antibiotic or antibacterial or antifungal products every day, this earwigs are being used. So in this earwigs, the treatment product is infused and which are left in place so that the earwigs are in place, releasing the antibacterial or antifungal product. And it can also help in reducing the inflammation, or in case of stenotic ears, this can be packed and left it like that so that it acts for certain period. So this earwigs are also used as a treatment. Just in case if you are in a place where you can use it, you can use until certain cases which needs a surgery, but until surgery you want to go with a treatment, this can be a treatment of option. So what is an earwig is nothing but polyvinyl acetate, and it has to be properly infused either with antibiotics or antifungals or a corticosteroids into a sponge and leave it in a place so that it will reduce inflammation, and it will reduce the edema and also control the microbial load. And it should not be used more than 4 days. So check on it that if you're going for a surgery in a 4 days time, then you can use this product. So systemic therapies, parasiticidals, if there is a parasitic infection, then you can go with the parasiticidals like your ivermectin, salamectin, or milbemazine oxime, moxidectin, or floralener or sarolaner. Depending upon the parasite or depending upon the clientele complaints, you can use any parasiticides. Antibiotics, if it is very severe, then you can go for systemic antibiotics. Otherwise, you can manage with the external applications. Steroids and anti-inflammatory, which is also again a check whether you are going to use systemically or whether we are going to use it only locally. So that also depends upon the severity of the infection. So antifungals, you can go with local. So most often don't go for systemic infection unless it has other systemic affections. In cases with atopy, for example, a case is there with atopy or allergic disease, then you have to go with a systemic treatment, because if you don't treat systemically, it's not going to have a control in the ear. So in such situations, you have to go. So for example, such conditions which has gone in for very worse and you need to go for a surgical ablation, still if the dog is atopic, your surgical correction will not just mere help. So you have to keep on treating the cases for the primary condition. So coming to radiography, there are two ways of doing a radiographic position to check for the bulla, whether it is calcified or occupied by any mass. So one is the open mouth rostrocaudal view, which you are seeing it, which is a very good view for examining the tympanic bullae. Other one is the lateral oblique. So these two will give you a better idea about the tympanic bullae. Tympanography is otherwise iodine diluted 50/50 with saline and infused in the ear canal, which can also be done. But now, since we have an advancement that we have a CT, we don't go for tympanography. Coming to meringotomy, excuse me. So in situations wherein which we have a bulging of the tympanic membrane, when you are visualizing, tells like there is a tympanic bullae is occupied by infection and it needs to be cleared off. How do we do it? We need to go for a meringotomy. Meringotomy is not a very big procedure to be worried about, but you should do it very cautiously that you don't damage the surrounding structures. For example, as I told, the nerves are there, blood vessels are there. You have to meticulously enter into the pars tensa. So here you need to have a sedation. Okay. So you need to know like how long I'm going to do it. It is also again, it can also be done within 20 minutes. That's not an issue. So you can go for a what do you call as mild sedation, or if you are not confident enough, go for a complete general anesthesia. So what you are going to do? So it is, you just see the video. First you pass a non-hurting rubber tube, insert it up to the tympanic bullae, then you protrude it into the tympanic membrane so that it just ruptures the tympanic membrane, then pass the urinary catheter into the tympanic bullae, then flush it with saline. Okay, so I just replay the video. So there is a tube that is being passed first. So inner to the tube, so inner to the tube, you are passing a catheter. It can be a urinary catheter that can be passed inside, flush the tympanic bullae. Then you can suck it out using a syringe. So this can be a bacterial, antibacterial solution or just a saline. You just go for flushing the tympanic bullae and remove the content. So over a period of time, this the mechanical rupture which we have caused will seal automatically. So this is a kind of rupture which the infection gets trapped and it gets, the tympanic membrane gets sealed automatically. The infection gets trapped inside and it grows. That pushes the tympanic membrane. That's what you have as a condition which has a bumping of the or concave looking tympanic bullae. So this is the place. There is a pars tensa. This is the place you have to enter so that you don't injure the surrounding surfaces. There are certain side effects when you use certain OT preparation. So I told you excessive use of certain products which have certain vehicle can cause a allergic otitis. So benzalkonium chloride, it is a quaternary ammonium preservative. It has lot of side effects causing surface ulceration. Propylene glycol, most of the marketed products will have a propylene glycol in it. So whenever you are going to use this otic preparation or a ear cleaner, you just check if it is having a propylene glycol. If it is there, don't use it repeatedly in the same patient. So check the content before you could use it. So this propylene glycol, again, it is a problematic content. So it can cause acanthosis and hyperkeratosis and also causes ulceration in the ears and swelling of the ear canal. And ototoxicity, ceriminolytics, squalene, as I said, squalene is safe when you compare it. Chlorhexidine 0.2% is safe. Povidone iodine as aqueous preparation, then alcohol is safe. Acetic acid 2 to 2.5% is safe. EDTA, tris EDTA is very safe. Fluoroquinolones in aqueous form, that is 0.2% of solution, is safe. So systemic antibiotics, again, you need to check whether there is any issues of certain systemic antibiotics or systemic agents. As you already know, like aminoglycosides are having ototoxic. So when you are using them, you use them carefully. Coming to surgery, there is no big discussion on it as per my topic here. When there is a chronic infection and you cannot deal it medically, the final solution is ear canal ablation. So there are two procedures, total ear canal ablation, and another one is TICABO, total ear canal ablation, and bulla osteotomy. So in general, when it is very chronic and you feel that it cannot be managed, TICABO will be a best option. And this can be done in discussion with the surgeons with whom you are associated with, or if at all you are doing it, you can decide upon the case whether it is going to get ready or not, and then you can proceed with the surgery. Even if you are going to do the surgery, if you are not going to treat the primary cause, the animal is going to have the problem continuing. So concentrate on the primary factors and treat the primary factors together. So in case if there is any doubts, you can post me the questions. I'll be ready to answer to you. So these are the few textbook references which I had, and few of the images had been taken from clinician brief. Thank you.
All right.
Maybe I was a little fast because we were running short of time, and I
No,
didn't
no,
want
doctor,
to.
it was fine. It was not that fast. Thank you
Okay.
so much, Dr. Sumathi, for that informative and practical session. Your insights into diagnosing, treating, and preventing otitis in small animals, along with your clear approach to interpreting ear cytology and managing acute and chronic cases, were extremely valuable for all of us. So thank you so much, doctor, for that. So now it's time for our interactive Q&A session. And if you have any questions for Dr. Sumathi or for the IAVD team, please drop them in the chat box. We will take questions one by one. So we got one question from Dr. Adarsh. He's asking any medical correction for oral hematoma.
See, that's what I told you. You go for primary stability of correcting the oral hematoma. You need not go for a surgical. The dog will not even get a oral hematoma. So the main findings is like atopy is one of the main reasons for having an oral hematoma. But as far as what I have dealt is, we don't go for medically managing such situations because it causes a lot of, if it is a erect pinnae, it may cause aesthetics will be affected. So generally we go for surgical corrections.
All right. So one more question is there. Treatment for rabbit ear mites.
So rabbit ear mites, we can go with Signalment. Signalment is really good. We can't
Okay.
use fipronil. We can't use fipronil in rabbits, but you can use Signalment.
All right, doctor. So next question is, can amniotic solution used daily for cleaning ears?
See, generally ear cleaning is not advisable every day. Ear cleaning has to be done when you have an excessive uh, secretions or excessive wax. Only then you are going to go for ear cleaning. If the dog is already having a ear infection and you need a everyday cleaning, then you can very well go with epiotic. And as I said, epiotic, in epiotic you can add if there is an inflammation, or if you are going to use antibacterial or antifungal agents, you can also use an add-on product as dexamethasone, because epiotic has um, hydrocortisone acetonate. So instead of that, you can, along with that, you can use dexamethasone
All
mixed in
right, doctor.
epiotic.
So next question is from Dr. Nanjopa sir. He's asking, what about use of NAC in otitis treatment?
So NAC as such in otitis, it doesn't have a big role, but as an antioxidant, it plays an important role in case of chronic otitis.
Okay. So next question, which stains are used in field staining?
Field stain is available as field stain. So there are you can use spirit as a fixative, and the field stain has two agents to it. So it is marketed as field stain, which is being used all over India as a stain for identifying malarial parasites. So it is available throughout India, marketed as field stain.
All right. Next question, in chronic otitis cases, how long we have to use steroids, ma'am?
See, chronic otitis, basically you need to know like whether I'm going to treat this case medically or whether I'm going to proceed surgically. So you can treat it. There are three things you need to keep it in mind. One is whether the client is able to do it everyday treatment. Second thing is whether it is responding for your treatment, whether there is a response, whether the client is applying what you have given it in regularly. Second one, if there is any treatment response. If you don't have any treatment response, and proceeding with medical management is going to be obsolete. Then you have to think for the other options. And basically, you need to know why this chronic otitis has happened. So look for the etiology. That can be done only with your otoscopy, video otoscopy.
All right. So next question, how many ml of dexamethasone has to be added in amniotic solutions?
4 ml in 100 ml. 2 milligram per ml. 2 milligram per ml, or 4 ml in 100 ml epiotic.
All right. Yes, doctor. So next question, in chronic otitis, should we go for local glucocorticoid or systemic use?
Local is good. You can go with local. That's what I told you now. No? You can go with the add-ons dexamethasone.
All right. So one more question
If you can get mometasone, then it is better. I'm not very sure whether products with mometasone is available here. So if it is there, then it can be used.
All right. So therapeutic approach of blackish secretion, please advise and discuss on that.
Blackish secretion like I told you about the colors which we had been when we were talking about it. So whatever it is, you have to go for a cytology. Without cytology, treating it is it's not appropriate. So that will give you a clue. See, a dark brown to thick waxy, it is a ceruminous otitis. So you have to go with ceruminolytic agents. But before using a ceruminolytic, you have to go for a cytology also.
All right. So next question is, how long we can use 4 ml DEXA in amniotic solution and what is the direction for use? What will be antibiotic of choice if we have to follow this as first line treatment?
Again, how long it can be mixed, diluted and kept, I am not very sure. So I will not be able to answer that question. We can go with looking in certain already used in articles. We can check it. It's available as an article in the open website. And another one is antibiotic of choice. You can go with enrofloxacin. You can also go with gentamicin.
All right. So Dr. Jairam is asking, please explain advantages of Tris EDTA.
Okay. This CDTA is one of the agents which can be used to break down the biofilm. So biofilm formation is one of the major constraints in treating a case of otitis externa. What is this biofilm? Is a kind of like what you call is like a tympanic membrane for the tympanic bullet. So it forms a film which does not allow any of your agents to enter and act on the organisms. So this biofilm is very thick and something has to break it for the products to enter. This Tris EDTA is one of these agents which will break the biofilm and give way for our agents to go and act, particularly in case of Pseudomonas otitis. So they are used more particularly in Pseudomonas otitis. Only Tris EDTA will not help. So Tris EDTA along with antibacterial agents has to be used in such otitis.
All right. Next question. What are the possibilities of reoccurrence of oral hematoma in dogs and sometimes in cats?
It depends upon that's what I told earlier. No, I think I answered one of the questions. This depends upon the uh, factors, the primary factors. So we should know whether it is a case of allergic disease or whether it is having a parasitic disease, which predisposes this for oral hematoma. There are certain conditions which also lead to oral hematoma, like your immune-mediated hemolytic anemia, immune-mediated thrombocytopenia. These can also lead to oral hematomas. So we need to know like which exactly causes oral hematoma, and we should treat for the primary cause.
All right, doctor. So next question we will take. So what is the earliest age at which we can use imidacloprid and moxidectin spot on for scabies treatment in kittens?
Alternates, why do you want to go for imidacloprid and moxidectin? No, there are other products which can be used.
All right. So one next question. Can NAC and Tris EDTA used as regular ear cleansing solution?
Yeah, I don't have an experience with using NAC in the ear cleaning solutions, because there are no papers which I have gone through for using NAC in otic preparations. We have seen Tris EDTA, but N-acetyl-cysteine usage in otic preparations, I have not used it, so I will not be able to give an answer for that. I'm not sure like what kind of other effects it has when it is being used in otic preparations.
All right. So doctor, due to constraint of time, we'll take one more question and then we'll end this Q&A. So how much ml of or drops of ear drops like Pomisol should be put depending upon body weight of animal?
It is not like body weight of the animal, like you can use 2 drops or 3 drops. Whenever you are using an ear solution, you need to fill the ear thinner. It's not like 1 drop, 2 drop, 3 drop. It doesn't do like what we are being told in us. So you have to fill the ear with the ear drops.
All right. So one last question.
There are two things in it. One is like it's not like how we apply the ear drops and we wait. It is not like that. When you are using it in your pet, it's definitely going to have a movement or a shake. So few of them is going to be out there. So it's better like you fill the ear canal until you see they are full. You can apply them.
Okay, all right. So one last question we will take, doctor. So recently I found meiosis in ear pinna, and in this case I used ivermectin topically by diluting. Can are other options are also available? And also light on the biofilm formation by the pseudomonas.
No, I don't get this question. Like he has used ivermectin locally
Tropically, yes, locally.
and topically.
Yeah, so he's asking what are the
I don't think it needs to be used topically in ear pinnal thing. Like you can remove the um, maggots and then you can go with systemic medications which will help in removal. But maybe he has done it and he has found it useful. But the other part of the question I didn't get.
Yeah, it was not framed properly, so I'll read it once again.
Okay.
Also, put some light, I guess, on the biofilm formation by the pseudomonas.
So that is again a big topic to be discussed. Then I
Yeah,
have to have one more session.
it was already being discussed by doctor in the session.
Yeah.
So yes, they can go through once again when once it's uploaded on the website and on IAVD page as well. So thank you, Dr. Sumathi, for patiently answering all the questions. So with this, we conclude the Q&A session, and it's the time to conclude the webinar also. And now we invite Dr. Meera Sakre, Joint Secretary, IAVD, to deliver the vote of thanks.
Thank you, ma'am. I am audible?
Yes, yes, very clear.
Yes. Good evening to all of you. Myself, Dr. Meera Sakre. It is my great pleasure to deliver vote of thanks for this today's webinar. So first and foremost, I would like to express our heartfelt gratitude to our esteemed speaker, dear Dr. Sumathi ma'am, for sharing her valuable insight, practical experience with excellent clinical pictures and basics of anatomy, physiology, microstructure of the ear, different predisposing factors, diagnostic approach, and different treatment modalities and prevention for the otitis in small animal, diagnose, treat, and prevent. A sincere thanks to our Association for Veterinary Dermatology India, especially Dr. Nagarajan sir, President, and Dr. Jairam Ramani sir, Secretary of IAVD, for planning and smoothly executing this today's session. We also extend our deep appreciation to the participants, especially students, veterinary practitioners, field officers who join with us from the different areas of the India. Your enthusiastic participation and practical questions made this webinar very interactive. We are also thankful to the entire team of Drool for providing this platform, whose support continuously made this our IAVD even possible. We look forward to your participation in our next international conference of IAVD, which is scheduled from 4th to 6th June 2026 at ITC Royal Bengal, Kolkata. And in addition, one announcement from our organizing team that Kerala Veterinary and Animal Sciences University, they are started to postgraduate diploma in small animal dermatology. So this diploma, it is having 2-year period, and the detailed application and fee structure, it is available on the Kerala Veterinary University website. And the coordinator or course director for that diploma, it is Dr. Ambili VR, who is the editor of our IAVD. So thank you one and all, and stay safe and keep learning veterinary dermatology. Thank you once again.
Thank you, Dr. Meera, for the vote of thanks. And before we wrap up, a gentle reminder to all the participants to please fill out the link in the comments box to receive your certificates for today's session. And with this, we conclude today's session. Thank you, IAVD team. Thank you, Dr. Sumathi. Thank you, Dr. Meera, Dr. Jairam, sir, and the participants for joining us for today's session. And we look forward to seeing you at our future sessions as well. So thank you, one and all.
Thank you, everyone.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools. Feed real.
Feed clean.